Hello.
Hello.
Should we chat before the meeting?
Yeah, let's get caught up.
Icebreaker. Dan, your icebreaker.
I couldn't help myself.
No, you're like me, can't stand silence at all.
I know that Brian has called in. I see his name. Now it looks like we do have a quorum.
Good afternoon. Y'all see me? Hear me?
I can hear you, Brian.
Okay. That's very weird. I maybe need to slide this thing over. I don't know. I have no idea. Oh, I got to do that.
There we go. Now we can see you.
Yeah, that's so much better, right? All
You
right.
look like you're executive management. You're doing well.
Yeah, mostly
Fancy.
it's these are my running clothes, like a running gun battle.
You must go through a lot of dry cleaning then.
Ew. I'm not usually the one with the blood on me, though. That's why you wear a red tie. All right.
Must be a
We ready to
hospital
get-
here.
We about ready to get started?
Yes, we do have a quorum, Mr. Chairman.
Okay, good. Excuse me. All right, so I guess we should do start out with our welcomes and introductions, correct? So,
Yes.
I mean, I can see Julie and Sandra, thank you, Rhonda, Dan, Carol, Les, Eric. It's good to see you guys. Who do we have on the phone?
Chelsea, do you want to do a roll call?
Oh, yeah, that's a good idea.
Okay, this is Kelsey. I can run through the top of the list. Becky Cole. Hello, everybody. This is Becky. We have Diane. Hello, everyone.
So,
Lauren Noble.
Hey everyone, good afternoon.
Wes Lucky.
Hello there, can you hear me?
yes,
Great, thank you.
We have Ronnie Batchelor.
Yeah, I'm here. I'm just not in the place where I can show my camera.
Brittany.
Good afternoon.
We see Carol.
Hello.
We have Dan.
Hello.
Eric. I see Eric there. Hello. Double thumbs up. I like it. Joelle.
Yes, I'm here.
Jorge?
Hello, everybody.
Oh,
We see Julie. We have Kate Mundell with us.
Good afternoon. Yes, I'm a newcomer this month. Thank you for having me. I am the Director of Provider and Community Relations for Coordinated Care of Washington.
Welcome. We have Les Stolniker. We see him over there. Hello.
Afternoon.
Martha Landman.
Good afternoon, everyone.
oh,
Martine.
I'm here. Hi, everybody.
We see Rhonda. Hello.
Afternoon.
Sam Wardell.
Hello. Good afternoon.
We have Sandra.
Hi, everyone.
We also have Sulamita with us.
Hello. Good afternoon.
All right. Is there anyone else I did not call out? All right, Brian, I think we're good.
very good. Thank you all very much. As always, we start out our meetings with a recognition of the attestation of conflict of interest and our self-dealing transactions. Please be cognizant of those obligations as we move forward, and feel free if you need to accuse yourself or just hold back from voting if necessary. Next item we've got, we can, I guess we got to look at the board minutes for the last meeting. That is the June and August and June minutes, August minutes, and retreat minutes. Is that correct? Okay, thank you. So maybe we take a second to review them, unless everybody feels comfortable that they have been reviewed. And does anybody have any modifications they need to make to any of these guys? Okay. So let's start out with the June board minute, June board meeting minutes. Can we get a motion to approve the June ones?
This is Sandra. I'll motion.
Very good. Thank you, Sandra. Do we have a second?
This is Ronnie. I second.
Thank you, Ronnie. So it's motion by Sandra, second by Ronnie to approve the June board minutes. All those in favor?
Aye.
Aye.
Anybody opposed? Thank you. The next item was the board retreat, I believe. So if we can take a moment and get a motion to approve the board retreat minutes, that would be great.
I'll make that motion, Ms. Dan.
Thank you, Dan.
This is Eric. I'll second.
And motion by Dan, second by Eric, to approve the minutes of the 2020 GCACH board retreat minutes. All those in favor?
Aye.
Aye.
Okay, great. Any opposed? So that motion carries too. Thank you very much. And finally, we've got the August board minutes as well. So if we can, we did that in August, right? If we can get a motion to approve the August board minutes, that'd be great.
So Brian, they're pretty much one and the same. So the board retreat was the meeting minutes for August. So I think we got that covered. Thank you.
You always fake me out one time. All right, that's good. Thank you very much. Okay, so that's all good. All those carry. The next item up for bids is the GCACH reports. Carol, can you kind of manage us through that?
And as usual, we will just have the staff report on the articles that they've written.
Great, thank you. I think the first one is Wes, right?
Correct. Go ahead, Wes.
Wes,
So, yeah, can you hear me?
yeah, I was going to tell you to start using your outside voice, Bubba.
Thank you, Brian. We'll try to go inside. So the Washington Health Alliance is a well-established organization with a national reputation for assessing quality using claims data from commercial and Medicaid payers that covers about 4 million people. They have put out 13 iterations of their community checkup report, and their most recent iteration now includes a composite score. And the composite score groups together several domains, and within each domain there are specific measures, many of which we're familiar with, such as diabetes checks, being on a statin if you have cardiovascular disease, and similar measures like that. It says here what those particular domains are: prevention and screening, chronic care for chronic diseases, and some of the. So the composites were rolled up to the county level and to the ACH level. And within this first iteration of the composite percentile, which you can see in that column there, the Greater Columbia is scored on top of all ACHs for Medicaid clients in the state of Washington.
Wow.
I want to point out that the measures that are included in the composite score are identified as being strong predictors of quality primary care. So this is for 2019 data, and we believe that our work at Practice Transformation has really leveraged these efforts. In an evaluation of individual counties for the Medicaid insured population, Franklin, Benton, and Yakima counties had the highest composite scores. So good work to everybody, and we want to thank our providers for the great work that we're doing, and we hope to build on this going into the future. I just want to point out real quickly that the difference between the first ACH hours and the second ACH is 15 percentage points, which is frankly a really wide gap. So again, kudos to all of us.
Yeah, that's really good. That's a huge deal. Congratulations. That's great.
So Wes, this is Dan. So in addition to the focus on primary care, is there any additional drill down as to why that 15% is so, why that gap is so large? Are we getting additional information? And maybe you're going to go there right now. But I'm very curious about the additional kind of specifications on that gap.
So I don't have the detail in front of me, Dan. We can talk about that. As I mentioned, all these measures are rolled up into particular domains. And for, I believe, at least 2 of the domains, we scored very, very high. And I think one of them was around preventive and chronic care management. And again, those tie directly into the work of the Practice Transformation Toolkit, part of what we've come to call the Greater Columbia CARES model. So, we'd like to believe that improvements in primary care, building on the successes of some of our organizations, but also building new successes in some of our other organizations, it's leading to these higher scores. But we can talk offline and I can show you more detail around this. And if you go to Community Checkup Report, I think it's communitycheckupreport.org, which is part of the Washington Health Alliance, you can get detailed data. It also rolls up to the county level. I did an analysis for Kittitas County. They're performing very, very well. We made a presentation to their LIN there.
Okay.
I actually have. I also had a question when I saw this. Is there anywhere that tells us the trend in terms of for each of the ACHs, the progress from baseline to where we are now?
Since this is the very first iteration of the composite score, Rhonda, there really isn't any trend data available right now. There is some trended information that goes back, I believe, at the medical group and the clinic group level. I have to be honest, the underlying data is a little confusing because of the attribution. I might have spoken to this group before about this, but whoever has produced a certain number of visits that can be classified as office visits that deal with E&M codes, even if it's a specialty organization like a surgery or urology or even a sleep center, they attribute that member to that particular organization, even though that may not necessarily be their primary care or medical home. So the way that they attribute it to the medical group and clinical group level is a little confusing, but they have no data to go on other than just claims data. So they have to use that for the attribution level. However, at the county level, it's where the Medicaid member or the commercial insured member resides. I hope that answers your question.
Well, sort of. I know because I do the provider attribution for our organization, and I've a couple things. I think it's interesting that they have us include like our behavioral health providers and our dental providers when we do the provider attribution, and the time period they're looking at is from July of 18 through June of 19 for this report. But beyond that, well, I guess what I'm, I think we're all impressed that we are on the top of this list. But the question is, I guess to me, is compared to what? Is that because we were, from the period that they were looking at, does this show that we have had significant improvement on the domains that they're looking at, or what does that mean? I guess how much have we progressed? I guess that's a big question in my mind.
And I think it's a good question, and I think it's more of a point in time assessment versus other regions of the state, comparing one region to another, one medical group, clinical group, county, and ACH to another, for at least this ACH composite percentile.
Okay.
Okay.
Thank you.
It's all really good. Other questions for Wes here? Wes, that's great. It's a good article. Thank you very much for that.
Thank you all.
Ruben, I believe you're next on here, are you not?
I can take this one for Ruben. This is Lauren.
Oh.
Carol, I don't know if you want to share that he is no longer with GCACH, but I will take this article for him since I worked really closely with him on this campaign.
Okay.
So this article just highlights our masking communications campaign in Benton, Franklin counties and Yakima as well. I'll start with Benton, Franklin County. This campaign created quite a buzz in the local Spanish-speaking community. We had advertisements on television, radio, Facebook, and reader boards. The messaging focused on highlighting well-known community members in the ads, and the campaign ended in August, at the end of August, so August 31st, and I will be showing a presentation later on the metrics for the campaign to share with you all. And then as far as the Yakima masking communication goes, the Yakima masking communications campaign goes, this campaign launched this week with similar messaging and will conclude the week of October 12th. The difference in messaging mainly for this campaign is that we also included children in these advertisements, although we still focus on well-known community members in the Yakima area. Similar to Benton, Franklin County, we are advertising on television, radio, Facebook, and reader boards. And of course, we will share the success of the campaign once it is completed.
Okay. It's very good. Thank you. Any
So,
questions?
Mr. Chairman, we should have probably prefaced the meeting by saying it's not that Ruben has abruptly left. He actually applied for a different job through the Group Health Foundation. So we're really looking forward to working with Ruben through his new position at Group Health. And so we fully expect for that to leverage that relationship and hopefully have it benefit Greater Columbia in some way or shape.
I'm sure it will. It's one of those birds of a feather. That's good news. I'm glad to hear that. Thank you. Anybody have any questions for Lauren on this matter? We're good.
I got a comment. You guys
Yeah.
about made me cry that he left.
Go ahead, Ronnie.
I said you guys had about made me cry and saying that he had left.
Oh. Okay. I think you're going to get to see him a lot more. So that sounds good. So let's move on to the next one. Miss Diane, ready to go?
So,
Okay, thanks.
yeah, so this initiative is for the assisted living. We did this much like our skilled nursing facility that we did the care package for. And this time we decided that we would partner with Numerica and that we would try to earn the money, raise the money within the community to kind of build that buy-in. And so Lauren worked really hard with Numerica and the TV station, and they ran a 2-day telethon. And our goal was $15,000 to raise, which Numerica really didn't think that we were going to raise it. To be honest, they were really, really concerned about it. And they're like, well, what happens if we don't raise it? But then once the telethon started, it just kept coming in and coming in. And so they were like, wow, you know, they were really impressed on how well this Shine Through for Seniors did. And we raised over $14,000. And so we will be using that money. I've actually already purchased most of the care packages for the 21 assisted living facilities within Benton and Franklin counties. And then we will be delivering them to them as soon as they come in. And they are really excited about it. The facilities, they're so thankful right now that the seniors are really feeling that social isolation. And so we're really excited that this went so well. And so we're looking forward to delivering those packages. We also added some of the money left from the skilled nursing facility project that we had. We went and used that to do the Heroes program, which is honoring the staff at these facilities as well. And so we're going to utilize that funds from that. There was around $4,000, $5,000 left in that. And so we went ahead and purchased those gift cards, and we're going to deliver them when we deliver our care packages for them.
Okay. Good. Thank you. Questions for Diane? Okay, very good. Practice transformation success story, Martine.
Yep, so this is me. This month, I decided to highlight Chaplaincy Healthcare as an organization. They have 2 sites going through practice transformation. They're in the 3rd cohort, so they're currently in almost at the end of their 3rd quarter of their 1st year. And I just wanted to highlight them, you know, both chaplaincy and their behavioral health programs, because they have really made, you know, really big changes within their sites. You know, their information, their tracking of the data is really good. As you guys have, you know, I've told you guys that, you know, behavioral health just purchased their first electronic health record for their site. So they're, you know, really utilizing it to, you know, I want to say to the top that they can right now. You know, they're still exploring it and learning, you know, ways that it can track their data. Both of the sites, you know, just recently, or they're actually in the process of contracting with Collective Medical, so they'll start getting those notifications when their patients go to the emergency department or to the hospital. You know, they have implemented decision aids, their risk stratification, they're providing care management. I mean, they have done, you know, a lot of good work, and I just wanted to highlight them for that work. And also, you know, their leadership, Gary has been, very supportive of this work within both of the sites. So I wanted to, give thanks to him as well, and just kind of give him a spotlight for all the work that they have done in regards to practice transformation.
Very good. Thank you. Very good. What do we have next on here? Back to Wes, right?
Yeah, this is just to talk about the mass delivery program that we partook in. The military department, FEMA through the military department, notified healthcare authority that they had a surfeit or surplus of masks that could be given to the state. Healthcare authority then notified about 178 of their the agencies that they come into contact with. They also notified the ACHs of the availability of these masks. A list was put together and an order was placed through HCA, and we received around 842,000 masks on August 5th, bundled into 28 pallets and delivered to the Franklin County Emergencies Operations Center, which instantly put the Greater Columbia into the PPE supply chain for Southeast Washington. So we reached out to our community partners and organizations, determined what their mask needs were. Some organizations like Tri-Cities Community Health came and picked up some pallets directly from EOC. However, for the majority of those masks, we rented a delivery truck, a U-Haul, and then a Penske truck on 3 successive Fridays, and made deliveries to Dayton, Ellensburg, Granger, Pullman, Toppenish, Walla Walla, and Yakima, and delivered to organizations such as Columbia County Health Department, Pullman Regional Hospital, KDNA, which is a radio station which I believe is owned by farm workers, Columbia Basin Health Association, Hospice Friends of Ellensburg, Walla Walla County Department of Community Health, United Way, the Yakima Valley Community Foundation, Benton Franklin Community Health Alliance, and the Yakima Nation. So we had a month to dispose of those or deliver those 842,000 masks, and we were able to do it by the 3rd week of August. So all in all, that was a very successful campaign. And at the bottom there, you can see some pictures of our delivery, as well as that far right picture of what all the pallets look like in the EOC warehouse once they were delivered.
And that's a lot of work. Okay, that's really good. Guys, we're all over the place.
And I might add, as a result of the success of all of the ACHs being able to distribute these masks on a local basis, we have been put in charge now of further mass distribution across the state. So while hospitals and the major users of PPE will still be supplied by the Emergency Operations Center, for the community distributions, the ACHs have been named as that distribution point. So we will have the opportunity to put in orders every week to fill for the community. So let us know if your community has particular needs for PPE, and it doesn't have to be just masks. We found out that we can also order other things like shields and gloves and gowns and things like that. So just let us know if your community organizations need anything, and we can put an order in that will be filled every week.
Okay, that's good. Appreciate that. Thank you all very much. That's good stuff too. All right, next one is the mental health concerns increasing. This is Carol.
Yeah, so actually this morning's whole entire leadership council meeting was dedicated about the concerns of mental health increasing as a result of any natural disaster. In this case, we were talking about COVID-19. So we got to hear excellent presentations by Dr. Kara Mouseth, and we also heard from Paul Nagel from Comprehensive. So this article really just stresses the fact that we are going into the disillusionment phase right now for as a result of this natural disaster, and there are things that communities can do to prepare for that. So this morning we were advised and got some really great information about what we could be doing in response to this. And I think this really factors into what we're talking about in terms of a community resilience campaign. And we'll be talking about that a little bit later. But there is a prediction that about 3 million Washingtonians will likely experience a significant behavioral health symptom within, the next few months, and that is compounded by other natural disasters such as fires, just the whole unrest of the country. And then Dr. Kira talked about going into the fall with daylight savings time and people being affected with SAD, seasonal affective disorder. So now is the time to really prepare for the reactions of our community members and be able to supply them with some tools to help them weather the storms.
Okay.
Carol, this is Eric.
Yes.
Yeah, just a quick question, and I apologize, I haven't had a chance to really look detailed at the agenda. To that point, we tabled something in the spring. Are we going to be talking about that today regarding mental health?
You will. Yep, it's the first thing under the items of discussion.
Sorry, I
Great, thanks for teeing that up for me, Eric. I appreciate that.
All right. Great, thank you very much. I should look up what disillusionment means again.
Not really happy about your current situation. Maybe somebody else has a better definition. That one's off the top.
I was going to say that sounds like Tuesday to me. All right. Very good. Thank you. Huh?
I just want to reiterate how I thought the presentation this morning was really good, particularly when she got into the discussion about the prefrontal cortex and executive functioning versus the limbic system and the subsequent consequences of kind of shifting from executive functioning to kind of limbic
Right.
functioning. So anyways, I just think those points were really, really well stated, and it hadn't been necessarily described in the manner that she did this morning in previous presentations. And I think it's, so regardless of whether or not you're dealing with employees or community or students, I think we really need to be thinking about how we will be supporting that work. Yeah, so kudos to the ACH for bringing that to the community. And I mean, there was like close to 100 people on the Leadership Council meeting this morning.
Wow, that's great.
Thanks for pointing that out, Ian. We had, I think, around 97 people. We also invited the list of community health workers that we had obtained from the Department of Health because we felt like this would be really important information for them. And then Chelsea just put up the, she put up the thing about disillusionment. There we go. So disillusionment is a feeling of disappointment resulting from the discovery that something is not as good as one believed it to be. So there's your definition.
Well, and in some ways that could be to our benefit in some of our communities.
True. That's true.
But I think we need to remember.
Thank you all for doing that for me.
I think we just need to remember the physiological component of this.
Yeah.
Particularly when we're stuck inside. That's it's just a whole added element or layer. So can't understate the importance of this.
Yeah, no, you're absolutely right.
I thought, actually, this is Rhonda. I thought all of the speakers had something important to contribute this morning.
All right, excellent. Let's move on to the 2020 Learning Collaborative schedule. Thanks, Carol. That was good.
So for the learning collaboratives that we have left, we actually added one in October. Becky Groves and Everett Maroon are going to present on tools for identifying and caring for patients with opioid use disorder, and it's kind of geared towards primary care. We're going to invite everybody, but that's kind of what it's going to be geared towards. They'll also talk about the trainings that there are for physicians to be certified in medicated assisted treatment and such. December, we're hoping to have a cultural sensitivity, cultural competency. Brian, I sent you an email. Hopefully you can reach out to me about, we're trying to get a hold of the lady that works there with you. So I did send you a message. So just look for that in your email.
Okay, I will. Thanks. Thank you for that. Diane, I'll chase that down. I probably have been remiss in getting back.
No problem.
So Becky, you got a welcome for Sulamita. Did I get that right this time? Okay. Becky, you got to turn your, there you go. You got to turn your microphone on.
Brian, it is Sulamita.
Okay, good. I know, Becky, are you out there?
I think her phone is, there she is.
All right.
This is a terrible thing.
Oh, I hear you now.
Okay. I'm so sorry. Mute is really just kicking my butt today. So yes, we hired a new finance and contracts coordinator, Sulamita, and she is a graduate of Columbia Basin College with a bachelor's in business management. And before coming to us, she was working as a property manager. She is doing a really great job. I won't read her whole bio because you guys can read, but she is definitely doing a great job. She's learning so much, and she's very eager to learn. And she told me the other day that she sat down and read a year's worth of our newsletter. So she's just impressing me left and right, and she's doing a great job. Sula, do you want to say anything? She's probably on mute, huh?
You're probably on mute again, too.
Well, anyways, welcome, Sula.
Yeah. I met Sulamita at the finance committee, so I think that's great. Congratulations and thank you. All right, what do we got next? These are
Diane.
I don't have my agenda.
Okay, so for the opioid resource ORN tracker, we actually, Benton Franklin, Walla Walla are on their second year. And this time I added a total there so that you can kind of see how many they've actually had in, for the 2 years combined, they have 184 total MAT inductions that they've done. And they have 115 that are still in treatment between the 30 and 90 days. And so they're doing really good. They did say that, last quarter really did, they had a lot less than they have been having, and that they believe is due to COVID. And if you could switch to the next one, the next page, there should be another page. Oh yeah. So so the other ones, Kittitas, Whitman, and Asotin, Columbia, and Garfield, their numbers for Kittitas and the numbers for the Asotin, they're really low, and that is due to COVID being half of their time. But then also, I just wanted to point out that that Kittitas ORN, they really are just their providers. And my recommendation is that we don't continue on for a second year with them. They're already part of the opioid grant with Comprehensive. They're a spoke for for that ORN. And I really do think that they're meeting the requirements that they need to for their that area by using that grant instead of us spending more money for them and doing 2 efforts. So that's my recommendation for Kittitas. Whitman is just blowing it out of the water. They're doing amazing. And their network has grown extensively, and they are actually combined with their local health improvement network. And so they have monthly meetings and things that I think would be good. And I do have an SBAR about continuing them for the next year. The Southern Columbia and Garfield one, unfortunately, Blue Mountain Heart to Heart and Tri-State, they're not working very good together. The communication between them has been lacking. And I think it has to do with it's just so spread out. It's really difficult it's been really difficult for them to combine. Tri-State does have a really good behavioral health program that they have there with some medicated and treatment physicians that they have there. And I believe that they're going to continue to do the work on their own. And so my recommendation is not to continue theirs for the next year. So the only one that I would be recommending it has an SBAR for today is the Whitman. And that's really all I have for the Opioid Resource Network.
Brian, I think you're on mute.
I said that's all that I have for the Opioid Resource Network.
Yeah, sorry. That was me. I was on mute. So we want to wait on the, apparently we're taking a tree down outside of my office. I don't know if y'all are picking that up, but it sure is nice for me in here. It's amazing. They can turn those things into like chips and stick them in the entire tree into a truck. I don't know how they do that, but aside from loudly. Do we need to do anything from here, or do you want to wait until we get into the SBAR? Do we got a decision to make? Okay.
Well, no, we'll just go ahead and wait till the SBAR.
Okay.
That's down in the action items, but I just wanted to point out those are just my my key takeaways from working with them directly.
Okay, that'll be fine. Okay, thank you. Thank you, Diane. The next report here is related to the DSRIP distribution report, and that is Becky.
Yes, sir. Thank you. So this very, 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 very long spreadsheet shows that we paid out $2.5 million in DSRIP payments tomorrow. Tomorrow is when it'll hit everybody's bank account. So we were pretty excited about that. We also had some process improvement changes for our payments that we make in a DSRIP, and as well as the way that emails get sent out to the provider. So look for some changes in that for those of you that used to receive those emails from Rachel. They're going to be coming from the CSI portal, so it'll be a little bit different now.
Okay.
So Becky, I think it's important to point out that all of these payments that you see used to be hand input into the financial executive portal. So the fact that now we can upload a spreadsheet that's generated from the tracker that the navigators fill out is making it a lot easier. But as you can imagine, as we continue to grow our sites and we have 85 with this many milestones to meet, it has become a tremendous workload. So I just wanted to congratulate Becky for taking the lead on getting this automated, and I'm sure Sulamita really appreciates it after seeing the level of work that was having to be done prior to this automation.
Mm-hmm.
Yes, I do.
Yeah, and also shout out to Dan Vizzini. He is, him and I worked together on this, and he was the brainchild behind the fancy formulas in the Excel spreadsheet that I can't even begin to understand, but he's amazing with Excel, and he did a lot of hard work on this for us.
Good.
Thank you, Carol.
All right, that's great. Good, thank you. All right, so do you all have anything else to do in the report section? Or do we just want to move on into the action items? Okay, let's jump into, Becky, let's jump into the financial reports for June, July, and August. How do you want to do that?
Let's just go. So we normally just look at the budget versus actual for the board meeting. We don't really go through all that, but I will say that you guys have all the financial reports, and they are for June, July, and August. One of the things that we talked about the finance committee, this document here, one of the things we talked about the finance committee meeting is changing the way that we report a little bit.
Right.
So next month, you won't see this, the budget versus actuals this way. Since I've been having Clifton Larson Allen helping me with the accounting while we transitioned Sulamita into her job. And one of the very smart accountants that we worked with from there showed me a very nice report that comes straight out of QuickBooks. So there's no data entry, which is what this entire spreadsheet is. And so it shows the budget versus actuals in the same format as the other financial reports. And so we showed the finance committee that this right here, thank you, Chelsea. So we showed this to the finance committee team yesterday, and they all really liked this. Or last week, gosh, when was that? Last week, sorry.
Last week.
So they liked it. So it has the same information. So there's the statement of activity, and then the next one is the statement of financial position, and then the last one is the true budget versus actuals that actually comes out of QuickBooks. So it's showing true numbers here. And so normally we run this report and then we populate that Excel spreadsheet. So as Carol mentioned earlier, I'm just trying to do some process improvement in the finance group so that we're not doing so much work because we're all really busy. And so I know Rhonda and Julie, you guys weren't there at the finance committee meeting, so this is the first time you're seeing this and hearing this. So I'd like to hear from you guys if you guys are okay with that new report. From Rhonda, a question to you specifically. We created that pie chart for off of your advice. Do you want us to still continue to have that in the new format, or are you okay with letting it go?
I'm okay with letting the pie chart go.
Okay.
But I appreciate your carrying it forward all these months for me.
One of the things we should add is we have had all of these June, July, and August financials have all come through Finance Committee. We've had a Finance Committee meeting in each of the months. So we've seen all the stuff and reviewed through it with the staff. And it's all been worked through, approved, and recommended for advancement up to the board. So Becky, I'm going to let you kind of, again, I'm not altogether certain how to present 3 months of financial statements, but I would like to.
I'm not either.
Yeah.
Chelsea, yeah, let's just look at this. So this is our current budget versus actuals report. So it looks the same as what you guys are used to seeing. It says it's through 6/30, but that's not actually true. I updated it through the end of August.
Okay.
And I just didn't change the date, so I apologize for that. So so this shows our some of our new projects that we're working on, our skilled nursing facility donations that are coming in. We'll also see on the next one the assisted living project that we've had some revenue coming in for that as well. Our Numerica bank account, we're not earning as much interest as we usually do, but we are still earning interest, so that's a good thing. And then down the expenses, we've got, oh, I should have taken that one off. So you can see on there that we're tracking really well for where we are in the current year. We have some things that we're not spending a lot of money on, like our contracts and professional services account and our traveling, obviously. Staff training, we're not using a lot of that money this year, but we don't know why. So, and other than that, I think we're doing a really good job. And so if you guys have any questions about this when you look through it, I know it's a lot of information, just please reach out to me and I would be happy to answer them for you.
Okay. The Finance Committee went through this the other day. I was on the phone with Kat. And do we have any, we had Kat and me, and do we have anybody else? Right.
Nope.
Okay. Oh, there's Kat.
Hi, Kat.
Hey.
And so we were ready to, we are comfortable recommending this up to the board for approval. And of course, to answer any questions, we did go through this in some detail. Becky advanced the new reporting structure where it just pulls straight out of the QuickBooks reports rather than having to transition out and then plug it into a spreadsheet and then plug it back into another spreadsheet. Seems to be that eliminated a lot of opportunity for keying entries and such. So that sounded like a good plan too. So we are ready to advance this to the board for approval if y'all are ready to accept it. We would need I guess I could put it forward as a motion.
That's Rhonda, I'll second.
Thank you. Any questions to speak to on this? All right. Anybody, all those in favor of approving the financials of the last 3 months?
Aye.
Very good. Anybody opposed? Okay, very good. Motion carries. Thank you very much, Becky. I know it's been a lot of work.
Thank you all.
Certainly there's a lot of reports. All right. So let's get into some of these SPARs. The first one, contract extension for the Whitman ORN. This is Diane.
Yeah, so it's me again. So the last year we had them do their contract. It was $400,000. So this year, and they have been amazing with their organization. They have had their network. They've developed it really good. They have their monthly meetings and everything. They actually have someone hired specifically to run this ORN for them. That I really liked, having that dedicated staff. And that's kind of how Benton Franklin and Walla Walla are doing. They actually have people that are assigned directly to their ORN. And I think that has what's made the difference versus the other two smaller ORNs that were just using people here and there, and there was no dedicated time specifically meant for this. So if you go down a little bit further, Chelsea, so this kind of tells us where they're at. So they've had, only in 3 quarters, they had 68 medicated assisted treatment, and for their contract, it was actually only 30 for the whole year. So they doubled the amount that they are originally were required to do. And then they actually have 35 individuals still in treatment. And these are down, you could see right here the organizations that they have part of their network. Like I said, they also have they also do a lot of things with the Lynn there in Whitman, and so that has also helped as well. So my recommendation, our recommendation would be that we extend the contract for Palouse River Counseling as the ORN manager for Whitman County, and we do it for the same amount that we did last year, which was $100,000.
Okay. Do you have any list of goals and deliverables on that $100,000 for the upcoming year?
Yeah, so it would be the same as the the 30, they would have 30 more, they would need to have 30 more medicated assisted treatment inductions. And then we also added a couple other milestones for the Walla Walla, Benton and Walla Walla. And so we will add a few new requirements, and that we haven't set up the requirements yet per se, but I did talk with police. They did agree that they wanted to do another year worth, and that they understand that there will be some other contract and requirements. One was like that our October learning is part of the Benton Franklin Walla Walla's, one of their milestones. And the other milestone that we had for the others was to have put on a training and for physicians to be able to be certified to do the MAT treatment. So we'll come up with a couple. It'll be specific to Whitman, and so we will do that with them when it gets closer.
Okay. You feel pretty good about it?
Yes, like I said, this Whitman has really been, I've been really impressed with the work that they've done. Kim Thompson she is actually a substance use provider, and she is fabulous. She has really done, and she's willing to do whatever it takes to help that ORN be successful.
Okay. All right. Yeah, Kat, you've got a question?
I have a quick question. I'm supportive of moving forward with this, or we as an MCO sector are supportive of this. I think I've raised this question before related to the ORNs, and you all, Diane, you just might have to remind me. I think one of the questions that I have, so this is another extension, so just considerations for sustainability planning of how the great work that Palouse River is moving forward can be sustained, and even where might conversations be also with the state as they are looking into additional opportunities around recovery and different, expansion of specific services and shifting of payments a little bit. So again, sort of where sustainability conversations are, and have there been any discussions with the healthcare authority about some of their work related to substance use disorder changes that are happening?
So I haven't been in touch with healthcare authority about the ORNs and the sustainability of them. From my understanding with Palouse River Counseling is that they would be continuing to do the work whether they were paid to do it or not. I just feel that they should be rewarded for how much hard work they've been doing, and to continue to provide assistance for another year. But Benton Franklin and Walla Walla, they will definitely continue on after we're done with them as well. It's some of these smaller areas, they're a little bit harder to coordinate the care, but what I found is like Tri-State, they've developed their their behavioral health program very well there, and so they're meeting those people where they're at, and going to continue to provide that assistance for the next year, and so that one I didn't recommend to continue to go forward because it was a partnership between the two of them. And when I talked with Josh from Tri-State, he just said, it would be better if we just continue to do it on our own. So I think these organizations already plan on continuing the work that they're doing now, whether we fund them or not. But yes, it would be good to have a conversation with healthcare authority. I have not reached out to that yet. So that might be something that we can listen to.
All right.
Kat,
I wanted to just, oh, I was gonna make a note to follow up. I'll just send you some information about some of the road to recovery work that's happening at HCA and if there's alignment there, so you guys have some awareness into that space. I don't know if there's a connection.
Very good.
Okay, thank you.
Kat, I just wanted to remind you that we have seen these opioid resource networks as bridges, so that we're trying to build capacity within provider organizations until they can hire on a MAT treatment or have these compacts or MOUs with MAT providers. So, you know, the original intent was just for it to be a bridge. On the other hand, as we talk about MTP year 6, maybe there's an opportunity to contract with healthcare authority for, you know, furthering the work of the ORNs until such time is that we can get a more sustainable solution.
Good. Okay, are we ready to consider entertainment of a motion on this SBAR? And who would like to make that motion? Kat?
Sure. I move to approve the contract extension with Palouse River Counseling as an ORN network manager in Whitman County.
Excellent. Thank you very much. And a second by Eric. Did you second that? Very good. So thank you, Kat. Motion made by Kat, seconded by Eric. Any additional comments or questions to bring to Diane? If she can answer them, because she sounds like she's faithful.
Okay, Diane, I'm going to make this real quick. Can you hear me?
Yeah.
Okay, just want to be sure that I'm being heard. Where does this leave us as far as having resources for those with opioid addiction and looking for help? Is this going to be like a deficit in the support, or is this going to be covering what would have been otherwise?
Well, we are people that have need help. We're really trying to focus on training our primary care physicians on ways to recognize patients with OUD. And so that's kind of where we're doing some more trainings for that, as well as the capacity. They're adding more physicians to treat the capacity. So access to patients, access to the process will be better for the patients. And so that's kind of where we're going in the future, and that's what we're really focusing on. And so we still are with the behavioral health providers in our region, you know, to help them. The substance use providers, you know, are available to treat their patients as well. So, I mean, I think that we've already been working on a sustainability for this. It's just now we're going to start working on it further.
Okay. Very good. Thank you. Rodney, does that get your question answered?
Kind of, but I'm just, you know, it's like when we pull out, and I know that it's for the training and learning and things like that, but I'm just wondering, you know, where that leaves the consumer is all, and if it's a deficit that's needing to be filled when we leave.
In the remaining, in the other two ORNs?
So in Kittitas already has, they're working with the state opioid grant, and they have their physicians all trained, and that area has already been, pretty much the bridge has already been created there. In the smaller counties, like I said, Tri-State is really stepped up, and then to handle it on their own, and they just wanted to continue to do it on their own from now on. And then Blue Mountain Counseling, they've already been treating patients in Columbia County, and they will continue to do that as well. So the patients will still have an avenue in those smaller counties, and there was no advertising for the ORN at all, and so it wasn't so they're not, it's not like creating a deficit, I should say, that they already had those programs set up, and they just haven't developed their opioid resource network as we had wanted them to do. And I think a lot of it has to do with because it's just the smaller counties and they don't have as much resources as some of the other counties. And I think that was probably the issues there.
Yeah, and that's just my concern, because I do know that the smaller counties are usually those that don't have the resources or have limited resources, and so the coverage is typically strained in services. So that's it.
Okay. All right. Are we prepared to vote on this motion at this point? Ronnie, are you comfortable advancing?
Yes, I am.
Okay, good. All right. With all that said, thank you for the conversation. I think those are good questions. Diane, thank you for putting all this stuff together. I think it's a good recommendation. So we have a motion on the table by Kat and a second by Eric. All those in favor of approving or advancing the next year with the Whitman ORN, please signify by saying aye.
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 Anybody opposed? Very good. Motion carries. Thank you very much. Congratulations, Diane. That's good. The next item we've got on here is a COVID stipend for Greater Columbia ACH staff. We talked about this a little bit in the Finance Committee, and Carol, thank you for preparing the SBAR on this. Would you like to drive through this one? Or do you have somebody to speak through it?
No, thank you, Mr. Chairman. I'm actually speaking on behalf of all the directors. The directors got together and really felt like this was an important item for the recognition that staff has been working, teleworking since actually a little bit before March 23rd. That required all employees and state residents actually to stay at home during the COVID-19 pandemic, except for you special essential workers that have been working in your offices. So since that time, GCACH employees have been working from home, which has required, a number of adjustments to their home life, including incurring expenses that they wouldn't normally have if they were in the office. We've also, in addition to that, taken on many new responsibilities just to meet provider and community needs. So many of us have set up home offices. We're using personal resources, printers, computers, desks. We've displaced other spouse members that might have been trying to work at home too. And so it's caused a little bit more additional expenses in utilities, lights, gas. Certainly we're all using our own internet resources. Some employees have been taking care of children while at home or hiring childcare and doing homeschooling. So we just wanted to point out that despite that, we've really stayed on track with all of our practice transformation responsibilities and taken on some new workloads. We did reach out to some other ACHs to find out whether or not they were offering their employees stipends. As far as we knew last week, Elevate Health and Better Health Together were the only ACHs that we know so far that have enacted payments. Elevate Health was allocating $500 per employee and then $100 a month since March. And Better Health Together is offering $75 a month to their employees. So the directors would like to offer our staff compensation for working from home the past 6 months and suggesting approximately $1,000 per employee for 11 employees for COVID compensation. You can tell I'm a little nervous about this. This funding could come either out of the salaries budget, which is a little bit under expended by $53,000 year to date, or we could take it out of staff training that has a current balance of $23,456. So that is our recommendation, that the board of directors authorize GCACH to compensate GCACH employees $1,000 as a COVID stipend.
Okay. Thank you. Part of the conversation that we had when we advanced this in Finance Committee, actually initially I was against it. I think intuitively, we talked a little bit, and I visited with Kat in the discussion, and shared with me that in fact working from home creates a bit more, a different level of expenses than one might otherwise incur. I mean, I was sitting there thinking, gosh, I'd love to stay home, but it actually does cost you more when you do stay home. You know, you've got, as Carol was saying, you end up buying chairs and, you know, burning up your own printer stuff, and there is some inconvenience. There's some real costs associated with childcare, bumping your family around, all that good stuff actually does have value, and hard dollar costs, which I was not, frankly, aware of and have really no experience with. So I appreciate that, and frankly stand corrected. So I believe that we can get behind this. I think the three of us who were at the board or at the finance committee the other day felt comfortable advancing this proposal in an SBAR to the board so that it makes some sense. And actually, I feel good about it. I think we are ready as the finance committee, are certainly ready to advance it as a recommendation to the board as well, and probably could use a motion and then discuss it some more if we need to.
This is Ronnie.
Yeah, Ronnie.
A motion that we consider that and take the recommendation.
Okay, thank you very much. So we've got a motion by Ronnie. Les, would you like to second that?
Actually, I'll add some other questions. So,
oh, okay.
I guess I'll wait till we get into the discussion area.
That's fine.
This is Sandra. I'll second it.
Sandra, you want to second it? That's good. Okay, so Les?
So, you know, looking at the thing that was prepared, the SBAR thing, I calculate, and if this is, so the first thing is, it says this is for the past 6 months. And I don't know if this is for, you know, if we should say this is for the rest of the year. I just, when I look at the past 6 months, I mean, it's not enough money to pay for things. I know that. But I just, when I looked at the amount that the other two agencies were paying, this is what I would think is, well, I guess I didn't do the $500, then $100 a month. So, but it seems like it's more than both of them. And I don't have the issue, I guess the concern I have with this is, does this mean we're going to do this every 6 months? If this continues, does it, you know, what does this mean for the system? So if I see this as a short-term concept, do we need to think of something in a more long-term policy, how we're going to deal with this? Because this may go on and off for a while. Mm-hmm. I don't know. You don't understand. So I'm not averse to this. I just, you know, so in December, are we going to say, okay, another $400, or you know, or is this something that's supposed to take care of this situation for a while?
I appreciate your thought, and I've had the same thought. My initial impression on this one, especially again after having visited with Kat and the team the other day, I think there's some, just like everything else, there's startup costs, right? When you come home first, that's when you got to buy the computer and you got to buy the. Mm-hmm. You know, I would assume that you all have your computers, but you know, you don't have your office chair, you don't have your whatever. And then you buy it, and now you got it. And so I think that's why you're looking at the $100 a month thing. So Eric, you've got something. Rhonda's got something. Sandra. So there's a bunch of folks. Let's start with Eric.
Just real quick, and to speak in the affirmative of the motion, I do support this. Having helped a family member get herself set up, I can certainly see the startup costs. But like Les, I will say that one of the things I guess I would like to see in it, and again, I fully support this, is none of us know when this is really going to end. And I would like to see something that at least, if not right now, speaks to very soon what is the plan moving forward in some form of a monthly idea of what this might look like. That's all I had. Thanks.
That's fine. I think that's good. Rhonda, you next?
Yep. So I support this as well. And I don't feel a need to have a plan for the future. I support that we call it a one-time appreciation gift. I think that we are in unprecedented times. We don't know what the future holds. And if we decide in the future to do another one-time appreciation gift, if we have funds available, I think we have the ability to do that. This is not a huge staff. We did this for our staff, and we have a large staff. You know, whether we'll ever do it again, I don't know. But I think a one-time acknowledgement at this time, I think, is appropriate, and we can do it. And I don't think we have to analyze it too deeply, or else. I just don't think we have to analyze it too deeply. I think we can acknowledge it as one time and say thank you for continuing the work.
Okay, good. Thank you very much. And we can come back in the future and do another one if we need to. Sandra?
This is, I agree with, Rhonda took most of the words out of my mouth because I agree. I think we should acknowledge this as a one-time. There are, as someone who spent the money and has all the startup costs and a duplicate home office, like I know that that's a big expense. So I very much support this and would have probably even supported if they would have asked for a little bit more, to be quite truthful. But I do think that we also just need to, just like with this SBAR, I think we can trust our GCACH directors to read the staff and, you know, have their thumb on the pulse of the staff and what it is that they really need to be to continue to be successful for our organization. And they can come back to us with another. My only other comment was that I would suggest that the funding come out of the salaries budget, since it is underspent, rather than the training budget, as many trainings have gone virtual. So there still might be a need for staff to participate in training. So I don't think that we should take from that training budget.
Additionally, I agree with you. Additionally, I think you'd almost have to, because this is going to get looked at as income. And so you're going to want to tax it.
Yeah.
Okay.
Yeah, I'm in agreement with Sandra on that. This is Ronnie Batchelor. Sorry, I didn't mean to butt in.
Okay.
However, I'm in agreement with the one-time thing, but I do think that if we're going to bring something back to the board, because there's a few people that are in their own business that are looking towards the year end and budgeting that out. And I think that if you bring something back to us, that we kind of look at that, because being at home is an inconvenience for most families, most people, to work from home. There is a certain cost that comes with that. And I agree 100% with what we're doing here. I just think that if you guys bring something back, that we kind of consider that budget for salaries and keep the training budget where it's at, but consider what's left of what the under budget is, and consider if you're going to come back with a comprehensive end of the year new budgeting for the next year kind of plan.
Okay.
If that
Okay.
makes sense.
All right. Thank you, Ronnie. Thank you, everybody. It's all good conversation. And again, stuff I have no experience with. So it's all new to me. I appreciate the insights. Do we have any other thoughts or comments to make on this, or do we want to take it forward? All right. So again, we have a motion by Ronnie, seconded by Sandra, to go ahead and advance the COVID stipend for the GCACH staff in the amount of $1,000 per staff member to come out of the salaries budget, currently under budget by $53,000. So may I have, I guess, all of us in favor, please signify.
Aye.
Aye.
Is there anybody opposed? Motion carries unanimously. Congratulations. It's very, very good. All right. Thank you very much.
You. Thank you.
Of course. All right. So the next stuff on here, Carol, you've got community resilience campaign discussion items.
Exactly. Thank you. Again, thank you, Board of Directors. That's really meaningful, and we really appreciate it. Hopefully we'll all be back working in our own offices here soon. The governor did release a plan that allows professional businesses to come back at 25%. So we can actually have 3 people in the office at one time now. So hopefully that will increase to 12.
You got 850,000 masks that you can wear, you know, so you'll be good.
Yeah, thank you. So
Plus, you can order more PPE.
Exactly. Just give me your orders. So as mentioned before, the community resiliency campaign was on the agenda for the staff or the board of directors in May. And I just wanted to reiterate kind of some of the comments that we got about the community resilience campaign from some of the board members. So I know that there was some concerns about not finding or not understanding what resources people really needed from the last campaign. I think that there was some disillusionment maybe about some of the measures that we didn't have that judged the effectiveness of our Yakima pilot. So we were requested to go back and maybe think about the measures. There were some people that said maybe this is just a timing issue. Maybe we don't want to move forward with an ACEs resiliency campaign. Maybe this isn't the right time. We need to bring it back to the board. I know, Eric, you had said that at the time that the city was on hold for some kind of expenditures. We didn't really know what the future held. But then there were several board members that said, you know, this is really an important topic for our communities. Domestic violence rates have increased. We're seeing possible more suicides. So I think that there were some split ideas about, you know, the timing of when we should bring back a community resiliency campaign. We know from the information that we received this morning that we are in this disillusionment, this disappointment phase that is natural to follow a natural disaster. And the fact that community resiliency and individual resiliency, I should say, can be learned, it can be taught. And so we think that this idea of what's happening with COVID takes on a completely new meaning during this time of disillusionment. And so we did reach out to the Community Resiliency Task Force to get some more ideas about, you know, is this the right timing? Should we change the messaging? As you recall, the messaging before was really about childhood ACEs. The reality of it is that all adults right now are being impacted by the COVID pandemic. And we really think that if we're going to do a resiliency campaign, it needs to consider the breadth and the scope of the whole entire community. I've asked Lauren to perhaps share some of the ideas that we got from the CRC task force as part of this discussion. So Lauren, are you prepared to go through that survey with us?
Yeah, I'd be happy to. Chelsea, can you pull up the results, please? So we put together a survey, as Carol mentioned, and we sent out the survey to the Community Resilience Campaign Task Force just to get an idea on their perspective of, you know, as a result of COVID, who should our target audience be, and so on. I'll go through each question. So we received, I think we actually received 5 respondents. The 6th person that responded might be a duplicate, I'm not sure. But either way, we sent out the survey. There were 5 questions. The first question was, as a result of the pandemic, who should the target audience be? And answers included the underserved and underrepresented population, high-risk populations, homeless individuals. Question 2 reads, as a result of the pandemic, how should the messaging change? Answers included highlighting mental and physical health, proactive care, resilience, and having an emphasis on protective factors. Question 3 reads, from your perspective, what is the best timing for the campaign? Most answers included the majority of the responses said now until the end of the year. Question 4, what would be the best available metrics to measure the campaign's success? Answers included number of website clicks, training attendees, and number of impressions. And then question 5, is there anything else we should address with respect to the Community Resilience Campaign and next steps? Answers included funding, lessons learned, and how we can promote hope during these difficult times. And all the answers are included in there if you want to go through those. I just, kind of went over a high-level overview, but we thought that may be useful to use in this 9-county launch.
Okay.
So I think the reason that we are bringing this to you is that the board asked for us to revisit this after about 6 months. And so here we are. It's been about 6 months, and wanted to get some discussion and direction from the board of directors with regard to if we move this forward, how should we move it forward? We got some excellent presentation materials this morning that I think give us some great ideas on how we can use that information to benefit our own employees and our community in terms of resources and training. So because Ruben's not here to advocate for this, I said that I would present this information to the board.
Okay. What do you need us to do with it? Do you need us to chew it up, visit, talk about it, approve it?
So, Brian?
Agree with it? Yes, Rhonda.
So, and I was the one, let me fess up. I was the one that had some concerns the last time about how do we know if we're making a difference. And,
right.
And again, just on the heels of what we saw this morning, I guess, my thought is this, honestly, I don't think this tells us a lot, the survey with only 5 people responding, but is there a way that, and I don't know, Carol, who are the best people to do this, but whether it's somebody on the staff or somebody in the stakeholders that could take some of that information we learned this morning, some of that information, and say, what is the best approach? Or even ask some of those people that presented this morning, if we had money to effectively run a campaign, what would you do? I mean, is there a way we could ask the experts the best use of those funds if we wanted to make a difference, and what should we be measuring?
Okay.
That would be my suggestion, because I think that, if we have an opportunity, we should, and based on what we heard this morning, that we should try to use an approach that's really going to make a difference and that we can feel good about it, rather than just send messages that measure clicks, because I just don't think clicks are a measurable outcome.
Okay.
That's a good idea. I mean, you've got the experts there. That makes sense.
So when we start this kind of thing, we had some information that helped us understand the issues that we had in our community and the level of those issues and why this was important. They may have been fairly soft things, but can we go back to the experts or however we got that original information and find out? Or is that kind of silly because the world has changed so much that, the same measures probably wouldn't show any change because we're already beyond with the trauma, the social traumas and things in our region. So I just think that one of the things that when I talk to nurses is how did you figure out this was a problem to begin with? That's what you're going to look at when you're done to see if you've done anything for it. So that's kind of was my point of view. How did we know this was an issue, and then how can we look at that again and see if it's moved? Again, that's a real great theoretical look at things. The realistic changes we've had since we started this, I don't know if we could measure anything other than maybe people would start knowing that we're here and that kind of stuff. What do you think?
So we know, well, so, I'm just kind of thinking about this morning. We know that substance use is up significantly. We know that suicides are up significantly. Should we be targeting messages about, do you know where to go for help on these specific issues? And, Paul Nagel-McNaughton talked about you know, using different words. Instead of talking about suicide prevention, they talked about safe. And should we be putting money into promoting those programs? I mean, I guess I'm thinking really specific messages targeting on the issues that we learned have really been impacted as a result of COVID. And I guess that's what I'm thinking about. And then we say, okay, Paul, did our messaging for your programs, did that increase? Did we make a difference there? Or did, you know, referrals, not referrals, but did people start calling Sundown or Merit or Triumph Treatment Services? Did any of our substance use providers, did they start getting increased calls? You know, the ITAs program, there wasn't a significant increase in that, which I actually thought was interesting. And that's probably a good thing. But I guess that's the kind of thing I'm thinking about is there a way that we could say, you know, we really helped connect people to the services that they needed? And we didn't really see that on the first go around.
You know, my curiosity is how it's being delivered, and just listening to you, Rhonda, and trying to track, it's hard to track something like that in real numbers. And something that happens to me every time I go to the pharmacy is that they send me a text, and that text says either your medication is due, or it says, can you leave us feedback? I'm wondering if there's somehow we can kind of put into this a text message. If you're something of the message of, if you're experiencing trauma, hit this button now. And then it takes them to a website that if they hit that text, it would be counted. Just a personal thought.
There's another group of so because I work with schools, I think that parents of school age children have been hit pretty hard with this, and I'm wondering if maybe part of the campaign should work with that all the schools have identified their quote at-risk students, and they're trying to do programs for them. Maybe there's something we should join with on that in reaching to those families. The other thing that happens, I don't know if it's all the counties, but when someone is positive for COVID or is a close contact, the health department sends them texts regularly and asks for feedback on, you know, how are things going? And they've added some psychosocial types of, social emotional, the right words, things into it. So I'm wondering if that's a population that we would consider at a higher risk, or is that already being taken care of? Just ideas.
So Carol, this is Lauren. We also have the survey that we sent out to our distribution list asking how COVID has impacted organizations. I'm not sure exactly how many respondents we've gotten from that, but I know that we recently sent that out again. I think we're up to 30 or 40 responses. Chelsea, do you know off the top of your head? Chelsea, if you're talking, you're on mute.
No, it just took me forever to get off mute. No, the last I checked, it was, I think, over 50 responses. So definitely, you know, a good response list. It was very varied across different industries, different sectors, in different regions. So we had a pretty good response rate, and it's still open.
Yeah, so that could be a resource too.
So I guess the question, Rhonda and team, is, you know, we know that this disillusionment phase is going to hit really hard. And, you know, Greater Columbia, we don't just stand by. We really like to be proactive about what we're trying to do. And I think we have the opportunity to be proactive. We have funding to be proactive with. I think I really like your idea of getting, you know, together again with the experts to get their recommendations. I think today was just, we're bringing it back to the board. We're trying to get some ideas on how you want us to move this forward. I think more than ever, it's really an important message because resilience can be taught. People can get out of this feeling and sense of hopelessness if they have the right skill sets. It's a matter of teaching and training them. I think there's opportunities to do that. We saw this great poster that Wes really liked that Paul presented about, when you leave your workplace, there's a checklist. We have ideas about messaging and how to treat each other during this time, the things that are really important. All of these things help build resiliency within organizations and within individuals. So I think what I'm hearing people say is, yes, let's bring it back. Let's have some specific recommendations in terms of a program of work. We've kind of already been working behind the scenes to develop these ideas. This might evolve into more of a, education and training component, which that would be very easy to track. How many people have taken the training, how many organizations are reaching out, and have these posters. So I think we can come up with a really good list of measures, especially working with some of the people that we heard from today.
Okay.
So today is just more of a discussion. It sounds like to me that the board is pretty much on board of moving forward with this kind of a campaign, not specifically targeted just for ACEs, but to the broader community. And then we'll bring back some more specific recommendations next month.
Okay.
Carol,
Martha has her hand up. So,
there's also a mental health grant that is in most counties. So you might look at that grant and how the counties are using that, and we might be able to tag onto that and make more of an impact.
That's excellent. Is that coming through the LHJs, Martha?
It's not. It's coming through. Some of it is through the CPWI coalitions, the Community Prevention Wellness Initiative coalitions. Columbia's with Walla Walla. Garfield has one. Asotin has one. So some contact names there.
That's an excellent suggestion. We would love to leverage any funding that we have, especially if people are thinking of the same, along the same lines. So thank you for that suggestion.
Okay. I think we have your marching orders, right? So we should be good. Okay. Thank you very much.
Thank you.
Appreciate it. That's useful. That's very helpful. All right, Lauren, would you like to speak to the masking and communications campaign, please?
Yes, so I'm excited to share with you guys the success of the Ben Franklin Masking Communications campaign. This slide deck really just outlines some of the important measures that I thought were definitely notable. While we tracked a couple of others, I'm happy to share those if necessary, but I'm excited to share this with you. Next slide, please, Chelsea. So I wanted to provide an overview first, in case you don't remember. So we were contacted by the Benton Franklin Health District to run a campaign in Benton and Franklin counties. The campaign was held August 1st through August 31st, and we advertised through the following channels: television, radio. We had a very, we spent probably majority of our budget in radio as far as advertising goes. Facebook and local reader boards as well. Next slide, please. So this first slide really talks about our masking distribution. So as Carol mentioned, we had received masks through FEMA, and go ahead, Chelsea. We distributed just over 840,000 masks in the Greater Columbia ACH region. That included cloth masks and KN95 masks. We also purchased Lucha Libre masks, which was the theme of our campaign, and we distributed 1,200 masks in Benton and Franklin counties. And that was very successful. Those masks actually flew off of the table. People were really excited to have those themed masks. Go ahead, Chelsea. So on average, our masking compliance is at a 97% across the campaign period. I believe it started at the beginning of our campaign, we were at about 95%. We ended at 98%. So how they came up with this number is they surveyed the Benton Franklin Health District surveyed 8 grocery stores in Benton and Franklin counties. And I think it was held weekly. I'm not exactly sure, but overall 97% is a great rate, especially since, was it in June or July? I think we were at around 30%. So that has increased significantly. Go ahead, Chelsea. This next slide outlines our advertising and engagement levels. For the most part, it's across the 8-week period, but I'll go through each one. So this first section is the number of callers that the 800 number received, and this is tied to 211. We included this 800 number at the end of our television and radio advertisements. So across just Benton and Franklin counties, over the 8-week period, they received 315 calls, and these are tied specifically to COVID. So that's about 40 callers weekly. And then as far as social media goes, this is just across 4 weeks. So the beginning of our campaign, which was August 1st through August 31st, we posted about 24 times. Some of these posts were boosted, which we received a lot of engagement on those. And the posts were mainly tied to our advertisements. So we just highlighted some of those interviews, and we got a lot of engagement that way. Those were very well received. As far as TV spots go, we purchased a total of 115 television spots for around 14 television spots per week. We had 2 different television spots. Both were 30 seconds long, and they actually matched the radio spots as well. And that brings me next to our radio spots. So we had 344 radio spots purchased. Like I said, similar to television, both were 30-second radio spots. We split the media buy between the 2 ads, and we had a weekly total of 43 radio spots through the campaign period. Go ahead, Chelsea. And then this slide just outlines the COVID-19 numbers on the day our campaign ended. So there were just over 8,000 COVID-19 confirmed cases in Benton Franklin counties the week of August 31st. That's 263 more cases than the previous week and 78 less cases than the previous week. So while the COVID-19 cases are increasing, the rate at which they're increasing is decreasing, if that makes sense. This next slide will explain that a little bit further. So as I mentioned, this outlines our campaign period. So July 14th is really when we started working on this campaign, while it launched on the 1st. So we started tracking from the 14th. As I mentioned before, you can see that the rates are increasing, but for the most part, the rate at which they're increasing is slowing. So that's the good news. And then the next slide is similar to that previous table. This is just for hospitalization rates and death rates. So same thing, the rates are increasing, but again, the rate at which they're increasing has started to slow. Next slide, please, Chelsea. And then this slide outlines our budget for the campaign. So overall, we spent about $17,000 on the campaign in Benton and Franklin counties. $4,000 of that was attributed to purchasing the Lucha Libre mask, which everyone loves. About $3,000 was spent with Spotted Fox Digital, of which created the radio and television spots, and they also provided us the link to each interview for us to download, so we can use that on our digital as well. So that worked out for us. We spent $4,500 in purchasing television spots. Only about $150 in Facebook advertisements, so that ad spend was pretty low. And then we spent $5,000 in Spanish radio spots. You'll notice a line item for distribution of masks, which is just under $1,000. It's italicized because we actually decided to take this out of another budget. as Becky had reviewed in our financials earlier in the meeting, our travel budget is pretty down right now. So we had some wiggle room in that budget, so we moved that into that other budget, and so for a total of $17,000 on the Ben Franklin Masking Communications campaign, which leaves us about $13,000 for the Yakima campaign, which is underway. Are there any questions on the metrics of the campaign or the success of the campaign or any of the measures I covered?
Eric, this is Eric. I have a question. And forgive me if this wasn't really the scope, but I'm just wondering if we can pivot a little bit here. I think it pretty much continues to hold true that we are not, and I am speaking specifically of the Tri-City area here, so this isn't to leave out the rest of the Mid-Columbia, but we continue to not test as many people at the GUARD testing locations. I think we're still at about half of the capacity, if that. And while certainly mask wearing is very important, to your point and your numbers, getting people tested and knowing the depth and the breadth of the problem is arguably just as important, if not more. So with the television spots, is there room to maybe pivot there a little bit? I loved the videos with the masks and everything, but also encouraging to getting testing, because one of the other things that they're seeing is that, and I don't blame them, I haven't had the test yet, but I've heard about it, and I got a hunch if I got it once, I don't want to go back and get it a second time either. But we've got to try to encourage, especially I want to say the population of the 20s and 30s-year-olds to get out there and get tested. Do we have some room there within the campaign to maybe pivot on that a little bit?
Yeah, Eric, that's actually a great point and kind of speaks to a discussion item that we'll be talking about a little bit later in the meeting. But Carol, do you want to maybe share that project we're working on?
I think, Eric, you're exactly right, is that you really do have to market these initiatives. It's not just enough to depend on people's goodwill to do it. And so a little bit of marketing, I think, goes a long ways, especially if you do it correctly. So I think because of the success of the masking campaign, the Benton Franklin Health District has asked Greater Columbia to offer some marketing for the COVID test site, the community COVID test site. And we'll be talking a little bit about that in a few minutes. But you're exactly right, is that you really have to get the message out in the right way that's culturally appropriate in order for it to be effective.
Hey, Carol, one of the things I've noticed is that the criteria for testing is different in Walla Walla County than it is in Tri-Cities and Benton Franklin County. So when you're encouraging people to get tested and they come to the Walla Walla County site, they won't get tested unless they have certain symptomology. So I agree that we need to test more people, but I'm not sure that Walla Walla County has the capacity. So I think we need to be careful when we do this to make sure we're pushing this idea in an area where that's what's really going on and what's needed. I don't know what's going on in Columbia and Garfield. There's Martha. Yeah.
Thanks. Thank you, Les.
This is Martha. I have a couple things. One question on, I like this campaign. Is there a way that we could take those Facebook advertisements, just take that part out of it and go across the 9 counties for a very reasonable cost? Facebook seems to be a cost-effective way, and just a question of whether that would be feasible. And then to answer your question, Les, it is different on the COVID testing and requirements in different counties, just because of capacity. We have a lot of people that come from Walla Walla and the Tri-Cities and get tested in Columbia County, just because we'll test anybody. People need to go back to work, we test them. People want to fly to Alaska, we test them. They come to the health department and get approval, so they don't have to go to a provider and have that cost to get approved to test. So we do a lot of testing in that area that they get turned away in Walla Walla and other places. So just keep that in mind as we're doing the COVID testing. And again, more testing would alleviate the capacity problem, right?
Mm-hmm. Okay. What else do we got? What else? I think the masking, I mean, certainly it's worked. Seems like, hearing it from the governor makes a difference too. Okay.
The other thing that there's Benton Franklin does a call with school districts once a week, and last week they basically Dr. Pearson was saying we need to plan on opening schools, going to the we expect to be down around the 75 per 100,000 in the next week or two, and let's get this school business started. That doesn't mean we're completely opening schools. That comes to 25 per 100,000. But she was very comfortable that we understand enough of what's going on in the community that she's put out a letter last week, I think it was, to the community basically saying we need to plan on opening schools by October 1st in Benton County, or on October 1st, I guess is what it said.
We are very successful we have been successful in Asotin and Garfield and Columbia so far with our school openings. We've had some additional cases specifically in Garfield County, but nothing school related. And so we're in our third week here of being able to do school and do it successfully. And the kids are very responsive. They don't even notice they have a mask on anymore. They're really, where the teachers are very impressed with the amount of involvement. The kids just want to be in school. They'll do at whatever cost that they need. If they need to wear that mask, they want to be in school. So there are no complaints there. That the staff at all three places have been very impressed.
Okay.
I wanted to speak to the great work that actually Ruben did in getting this to be such a successful campaign. Originally, we had an idea of not all heroes wear capes, right, in order to get people to wear masks. We took that idea to the Hispanic leaders in our region, and they came up with their own theme, the Lucha Libre theme, which resonated much more with them and their cultural values. And I think that because of that, because we listened to them and they had direct involvement in helping deliver that message and being in some of those commercials, I really think that it really made a much bigger impact as opposed to, something that we might have come up with. So I think I was really grateful for Ruben's expertise in this area and really reaching out to the community. I think it made a big difference in the success of the campaign.
Good. Okay, we ready to move on? Let's move on to I'm worried that we're going to run short on time here. So you have a legislative ask from the ACHs, right, for the MTP?
Right. So basically, this is just to let the board of directors know that Healthcare Authority is contemplating a Medicaid transformation program year 6. We had all worried about sustainability. How are we going to sustain our programs?
I say yes.
COVID has really hit the metrics really hard, and so HCA has approached CMS with the idea of an MTP6. What this will require, though, is the use of the Medicaid Quality Improvement Program funding to fortify the intergovernmental transfers. So HCA staff met with the legislative staff just this past Tuesday and indicated that they're not asking for general fund money, but asking for approval of using some MQIP dollars to help fortify this program. And CMS seems comfortable with this ask, but what the ACHs might be asked to do is to publicly approve this type of an approach. So we wanted to bring it to the board. All the ACHs are running this idea through their board of directors to make sure that the board feels comfortable with this proposed one-year extension for the Medicaid transformation program.
I'm comfortable with it.
Carol, is this an all-in, or what happens if an ACH doesn't agree? I mean, I'm not envisioning that's a thing, but just in case, what happens?
I don't know. That's a good question. So far, none of the ACH directors that we've talked to, they're all about it. The concern, though, I think, Sandra, is the level of funding. And what we did hear recently is that they've identified $139 million for Initiative 1. So we felt like we couldn't leave any ACHs behind, because some ACHs receive so little that it might not make sense for them to have a year 6, but we did get confirmation that there would be enough funding that would be reasonable for all ACHs to participate.
Okay, that's good. That's a great question. Just kick them out. At that point, they're just out. And there's only 6 ACHs or whatever. More for the rest of us. That's how I see it. Okay. Is there anything that we can do to support that as board members?
As long as we have approval from, maybe it should have been an action item, but as long as the board feels comfortable that I can advocate on behalf of the GCACH to proceed with the MTP year 6, then I think that that's all I need.
That's fine. I mean, I think we rely on you to do that anyway. Okay, good.
Great. Thank you.
You're welcome. Thank you. All right, next one is the participation.
Wait, Brian?
Yes, ma'am.
Just one question. I'll support him. I'm totally supportive, but just one question is, with what the legislature is dealing with the budget, what is the likelihood that they're going to support this?
Well, I think that's why it was really important to say that there's not any general fund money coming out of their budgets, and that the MQIP would have to be leveraged. And so really, Kat, you might have the most insight regarding this, because I know that MQIP is also a program that MCOs use for quality improvement in public hospitals.
Okay, thanks.
Yeah, we are just also getting briefed enough to speed by the healthcare authority about this. So I think there is at least support from the public hospitals. We had a meeting. That was actually why I was a little bit late. We were having a meeting just before this around the MQIP program and its relationship with respect to year 6. So I think the part of it will be is the explaining of the fact that it is not really asking for additional dollars, because there are those dollars available within the district funds, but it's the time at which to spend them because of the impacts of COVID. And so I think for the legislature to sort of recognize that, authorize that, and see it as supporting the communities and community health and providers, especially in a time of COVID, and not have perhaps some of the challenges that the legislature has had with the healthcare authority overshadow the importance of the, again, kind of continuing on this work and having more time to really establish a sustainability pathway. I also think that there's, the connection point with Initiative 2 and 3 is important, as that year 6 is also connected to Initiative 2 and 3, the long-term supports and services, and then the foundational community supports as well.
Okay, good. All right, thank you, Carol. Thank you, Kat. Next item we have on our list is participation in grant writing partnerships for feasibility studies and broadband.
So I'm going to tee this up for Wes. Really, this is an area that Greater Columbia ACH has not been involved in terms of trying to advocate necessarily for broadband or funding for broadband. I have participated on a statewide committee, but it's becoming a true equity issue, that there are areas of our state that do not have broadband, and because of COVID and kids having to learn at home, the telework, the telehealth, broadband has become more important piece and component of our everyday lives. Fortunately, the Department of Commerce is aggressively seeking federal funding for broadband and has come up with some opportunities for feasibility studies to determine whether or not projects are shovel ready. I know that the Yakima Valley Community Foundation has been involved in this work, but really Greater Columbia ACH has not. But if we were to get involved, I think what it would mean is that I would be bringing back a list of potential partners for feasibility studies. And the feasibility studies are so economical. They're $11,500 a piece. So if we think about getting a feasibility study done for that little amount of money, that's pretty remarkable. So I think, again, this is another opportunity for Greater Columbia Board of Directors to contemplate whether or not we want to go any further with this. And then I think Wes had a little bit more detailed information in terms of where we're seeing those gaps in services within our own 9-county region.
So I'm going to go ahead and try to share my screen, and hopefully this will work.
Yep.
Can you all see this coverage map?
Yep.
All right. So in thinking about broadband and the providers that make it available, many times there are two primary providers. One of them is public utility districts. Here in Washington, you can see across the ACH, there are PUDs in Kittitas, Benton, Franklin, and Asotin, but there are no public utility districts that we're aware of from the WPUDA in Whitman, Garfield, Columbia, Walla Walla, and Yakima. And out of the ones that are here in the ACH, only 2 seem to be offering telecommunication PUDs, meaning offering some sort of telecommunication services such as broadband. So going to the next available provider type, there are ISPs or internet service providers. This map is a little hard to see, but here's the Washington-Idaho border, the Washington-Oregon border. Yakima is here, Kittitas is up here. Again, there's no county lines to separate, so it makes it a little bit hard to see. But the primary provider here in the ACH is CenturyLink. You can see their availability. And notice here there are some gaps in Whitman, here near Asotin, and here around the Tri-Cities and in northern Yakima, the north part of Yakima. If we go to the next one, which is Spectrum, the coverage map becomes even smaller and the coverage holes become larger. Again, here in the southeast corner of the state, there's quite a bit of opening, and in South Yakima, Southwest Yakima. The third one is Inland Telephone Company, which I've never heard of, but there's almost no coverage across any part of southeast Washington. And the other ones are Pocket iNet with nothing, and Columbia Connect with nothing. So CenturyLink is really the bigger operator. So as we all know, there's been the Washington Broadband Survey, and not surprisingly, the results from the survey are pretty much in alignment with what we've seen in those coverage maps here in southeast Asotin, or in Asotin, you can see that there are broad holes. Here between the Tri-Cities and Walla Walla, there are also some coverage areas. Now, granted, we understand that there's not a lot of people living in these areas. Following I-82 and then I-90, where there's lots of development, there's obviously more people participating in broadband. But it leaves the question open whether some of these areas that are not responding might need additional broadband capabilities. For those areas that don't have broadband through cable, they rely or can rely on satellite. The problem with satellite is that, first of all, it's very expensive, and second of all, the reliability tends to be poorer than cable broadband. So there are some activities going on, as Carol talked about. The Yakima Valley Broadband Action Team, which is through the Yakima Valley Community Foundation, is supporting broadband internet connectivity. Stockio Beltran has been part of that. Sorry, I'm getting a blockage to my screen. Another one that's participating was Walla Walla that received $64,000. This was back in 2013. Excuse me, to the Walla Walla Valley Chamber of Commerce. They were awarded that money with the Intelligent Community Forum, a think tank. Oh my goodness, sorry, my screen keeps on going back and forth. A think tank that focuses on broadband-centric economic and social development strategies and leverage their expertise through its Community Accelerator program. We do not have any more information than that for Walla Walla. And other than that, let me click through some of these other initiatives. So the state agency, which was originally the Office of the Chief Information Officer, transitioned this over to the Washington State Department of Commerce in terms of state broadband activities. They now have this. They're the ones that are sponsoring the broadband access and speed survey, which we just looked at the results at. They've also have a drive-in hotspots locator finder, which isn't really a solution if individuals have to go to a hotspot to connect to either conduct commerce, such as business, have educational sessions, or do other activities. There's also a Public Works broadband construction grant and loan cycle that went through the 9th. It was extended, and unfortunately, it ended yesterday. So that grant cycle just recently completed, but was part of a broadband construction grant and loan program. The other one is the Community Economic Revitalization Board that comes also through Commerce. Unfortunately, this does not cover most of the ACH. The only areas that I saw covered in terms of what they consider rural communities to be are portions of Benton County, somewhat ironically, which includes places like Benton County. So that's just a little bit of background about what's available and where the need is potentially at. A feasibility study might assess, first of all, is there a need in some of these opening areas? And if there is, what sort of capabilities, technology, infrastructure, and other things might be needed to stand up broadband for individuals who do not have access to that? And I'll pause there.
Wes, I can give you an update on Garfield County and Columbia County. Both of those are being run, have been approved for a significant amount of money. Garfield County expects to go online with high speed in most of the community by November 1st. And Columbia is just a little bit further behind and is still working on the process. But the Port of Columbia is the one that's doing it, and the Port of Garfield is who's doing it in Garfield County. We've actually allocated some COVID-19 funds in Garfield County to do the fairgrounds so that we can move the court services out to the fairgrounds if needed for social distancing. So we are working on it hard in those two communities to try to get at least more access than we have now. But it is a problem in our areas, I can tell you that. Lots of mountains.
Martha, that's nice to know. Do you think that those two initiatives will provide region-wide complete access across the county where people reside and work?
Yeah, it's going to be hard to get all the way, but it's a giant step forward from what we have now, especially in Garfield County. But complete access is a whole nother conversation. But it's a giant step in the right direction.
And this is Rhonda. I was just going to say our work in Yakima County is not where we would hope to be. Our goal was to have 99,000 clicks by the end of September, and it has been a real challenge because as we've been sending out the messages, people think that they're that it's not, well, mainly that it's like a spam or that they're being asked to buy something or to when they send the click. And so, I mean, this looks like it might be Yakima County's test, the 24,000, because when we met last week, we were at about 22,000. And so we're definitely not going to hit 99,000 for our speed test by the end of the month, but it's been a real challenge to try to engage people to take the test.
Rhonda, can I ask you, or may I ask you, do you know what broadband availability might be in the Yakima Reservation?
I don't know the answer to that, Wes.
Thanks.
So
That's one
Wes,
area of concern that we've had for a while, is to understand what their availability is.
Sure.
We've had personal experience with going on the reservation, and I mean, one of our first encounters with Tanya Chris was walking into the behavioral health department in downtown Toppenish, and they had been without not just internet, but even phone service for weeks.
Yeah.
Behavioral health agency that responds to crisis. And, you know, to me, that was mind blowing. So that might speak to other issues across the nation.
Yeah, I know our staff. I mean, our staff do quite a bit of work down in White Swan with some of the tribal schools and areas, and I know it's non-existent there, but I don't know, you know, broadly across the reservation. I can't speak to that.
Les, were you going to say something?
Yeah, the superintendent's office, the state superintendent's office, has got some people working on, and I don't know what the actual program they're doing, but they're very much trying to get broadband to every student that needs it. And if you talk to Jack in our office, Jack Morris, he understands what's going on in our region very clearly to deal with how we're dealing with students and things like that, and staff.
Good.
There's a lot of different people that are very much looking at this. I think it's a good add-on, a good place to be to cooperate.
Yeah,
right.
I mean, I can tell you guys, I mean, I live near I-82, and I have CenturyLink broadband, but it comes through a satellite dish, and it's not very fast. You know, and it's like you said, everybody's on internet school, including my kids in college, and it's not so easy when everything's freezing up. So even with broadband, sometimes it's not great.
Exactly. You know, the idea is not to stand up infrastructure. The GCACH simply doesn't have the resources to go out and build towers and add ISP providers or expand existing coverage areas. One thing that we had been thinking about was perhaps asking the LINs to think about this, not to burden them with the work, but to think about in the areas that they cover, do they see the need or the benefit from having some sort of feasibility study being conducted within their service area to at least acknowledge and identify where there might be room for growth.
Yeah. There's a lot here. I mean, so you put a feasibility study together and that says you need more. Well, then what? I mean, okay.
Yeah, so the idea, Brian, is that there are these grants. There's a boatload of money that's coming through the federal government.
Yeah,
might be partly political, you know, to try to get into the rural areas, but
that's true.
But the feasibility study identifies shovel-ready projects, and that those projects that are ready to go, then we could bundle into funding opportunities. So I think this is just, you know, do we want to go forward if there's opportunity for feasibility studies within our GCACH, so that if we do have shovel-ready projects, those can rise to the top.
Yeah, to support them. Yeah, okay, I get that. That makes some sense.
Yeah.
Okay.
Yeah, one thing that Carol likes to tell me is that success lies at the intersection of opportunity and planning. And you know, if these studies are completed when the opportunity arises, that it just carries us that much forward when the money becomes available.
And there is that opportunity. I've worked with Curb before, and those guys are pretty good though. They can help with some of that stuff. And that was here in Yakima County, so they've got some breadth, maybe beyond what we think they do. All right, good. Thank you, Wes. It's really good.
Brian, I think Pat has a question.
Oh, yeah, I mean, I really am supportive of this. To your point around broadband being such a component of equity, it is so key. And also, as we consider just health access and as we're moving towards telehealth, it's really, really important. So I also know that, and I'm sure you all are aware of this, but that Better Health Together has been digging into this deeply as well. So as we consider sort of that eastern swath of the state and sort of where ACHs can band together and learn from each other, they recently, within the Waiver Finance Committee, passed, I think there was over $200,000 that was allocated to support some of this work as well. So again, I think there's some alignment of where ACHs are finding opportunities to consider, where they might be those kind of mobilizing forces of multiple sectors.
Yes, I think Allison has been beating the drum for all ACHs to climb on board, and we all had to promise that we would take this as a discussion item to our board of directors because of Allison. She's really been leading the charge on that. And you're right, I think it was $205,000 that they approved. So knowing what we know now, we can dig a little bit deeper and maybe have some proposals next month or the following month for the board to consider. Thank you.
I would just finalize by saying that this is really an issue in equity. If individuals can't afford affordable broadband access, it really limits the opportunities for a lot of areas of life.
Okay.
And the other thing though, we saw these broad areas that are outside. There's areas in Pasco that are dead spots. So this isn't a way out there concept. This is around the corner for many people.
The other thing that I would add is a piece of this is also asking people not only if they have access, but it's also asking them about affordability, because there are people that they might be living in an area that has access, but they can't afford it. And so a part of it is, if you don't have access, why not? And they ask, the test also says, how much does it cost? Right. And so I think the intent is, with this quote unquote boatload of money that's available from the FCC, is that the intent is that if the internet service providers have the ability to bring down the cost to make it more accessible, going to your comment about the equity issue, that it could potentially even bring down the cost to make it more accessible to low income people.
Yep. Great point. That's a great point. All right, let's move on to the next thing. We've got about 15 minutes to talk about COVID test site. Thanks again, Wes. That's good. That's good. And this is you again, Wes and Lauren, right, on the COVID test site?
Yeah, let me share something here again real quickly. See if I can find this. Ask for your patience just for a minute. Yeah, right here. Can you all see this?
Yes.
Okay, so this was an initial RFP that came through DOH and the Health Commons project. As we all know, Health Commons was the consultancy that helped stood up Community Information Exchange in Ellensburg, which actually seems to be going really well. They focused on a use case that dealt with individuals with behavioral health disorders, roping in community EMS into that use case. So they've become involved with this in standing up test sites throughout Washington, working with fire departments and health jurisdictions. Here in the Tri-Cities, that's the Benton Franklin Health District, that are willing to partner to set up and operate high throughput testing sites in their communities capable of processing about 500 tests per day. Successful applicants will have about $200,000. This goes to the health department to cover capital for the first 6 weeks. The community test site development service is based on a toolkit that they put together that has flow processes, job descriptions, and other information. This will also include supplies, lab services, and IT tools. They've pioneered a phone application using Epic, which is a very big national EHR vendor for registration and to get test results back, although those test results can also be emailed. There's also going to be help with long-term financing for other services, such as the vaccine delivery that might happen either at the end of this year or more likely some way through 2021. So this was put together. Originally, Health Commons reached out to us, so this is a lot more complicated than I could ever think. It involves the health department It involves the fire department, who acts as incident command, where they have a lot of experience. It also involves an employer to employ swabbers and registration technicians. So there's customer service people that help with registration, and swabbers who, as you might know, they're donning PPE. They go out to the cars and they swab clients who drive through the test site. They process those. The tests, the samples are then refrigerated, boxed up, and then sent over to University of Washington Medical Laboratories, which promises a turnaround of between 48 and 72 hours, which actually has been quicker than some of the other lab testing services. So the goal is to be high volume, low barrier, again, up to at least 500 test sites per day. We looked at what the National Guard site is doing here locally, and let me share those numbers with you. I can figure this out. So this is an analysis that we did with, or that I put together with National Guard data. This shows the days of the week that the current National Guard site is opened. This is a summary document. It's the average patient swab count from Tuesday to Saturday, which are the days of operation. As you can see, the first day after the weekend, tests come up and then they swing down. More interestingly, looking at the daily counts, the National Guard, at the most, they had 266 cases, daily patient swab counts right after the 4th of July. But for the most part, they're running at about 200 or less than 200 swab counts per day. It's busy, but there's probably opportunities through advertising that could reach out to some of the same channels that the Masking Communication Campaign, which Lauren is overseeing, might benefit the operation that they want to stand up in Pasco next to Columbia Basin College. So let me stop there and hand this over to Lauren and let her talk about what the marketing campaign might look like.
Yeah, so we've actually, Carol and I met the other day with a marketing vendor in the Tri-Cities to just talk about some ideas in terms of what the marketing might look like. And they came up with some great ideas. They were thinking in terms of advertising that we could, focus on, while you might not be saving your life, you could also be saving someone else's life. So putting it into perspective that you're bigger than yourself, this issue is bigger than just one person. And so, including well-known community members like the Masking Communications Campaign in this advertising as well. I think they had talked about interviewing some physicians that are well-known in the area. They also talked about, maybe having well-known community members being filmed getting tested to reduce that stigma. As Eric had mentioned, there's kind of a stigma around getting tested. We've also talked about having several promotional items handed out at the test site, like masks, hand sanitizer, and water bottles, kind of incentivizing people to come get tested, making it fun, if testing can be fun. Because we found out with our Masking Communications Campaign, since we tied a fun theme to it, it seemed to be really successful. We're also talking about having rack cards that are already actually created, sending out press releases, having posters at workplaces, like at maybe food processing plants or warehouses, and saying, here's a test site, here are the hours of operations, and then, maybe including, and come get your free hand sanitizer or something along those lines. We also talked about having a landing page on our website. So this will be a really big effort, but we think that we can reduce the stigma around getting tested, and these marketing efforts will be through the end of the year. Carol, is there anything you wanted to add around that?
Yeah, I think the big piece that we forgot to tell the board is that, again, the Benton Franklin Health District reached out to Greater Columbia ACH for this marketing. So this would actually, we would be paid to do this. We wouldn't be using our own resources. I think it was due to the success of the campaigns that we've run to date that they have confidence in our ability to reach the right target audience with the right communications message. So we go in front of the health district tomorrow with some of these ideas that we have for marketing. We'll put together a survey. One thing that was beat into my brain when I was working at the health department was nothing about us without us. And so we'll put together a very short survey. I think it's 7 or 8 questions that we are sending out to farms, food processing, smaller providers in terms of agriculture and essential workers, so we can get their ideas of when they think hours of operation would be the best for their employees. I think that there's a fundamental reason that we're only getting 200 tests a day in Benton and Franklin counties. I have a feeling that it has to do with the hours of operation, or perhaps there's other barriers that are happening. So by asking some questions, we want to get to the root cause of that, and then see if we can apply that in our marketing and operations. So it's very exciting to think that Greater Columbia is being asked to do this work. It's very important. We've developed some great partners. We've learned a lot more about Columbia Safety, who has agreed to take on the employment of the swabbers and registered technicians. That we were actually asked to do that and said, we just don't have the capacity to do that, but we are more than welcome. We are more than happy to do some marketing for it, and we think that we have the right people to be able to make it effective. So the partners at the top of the page, the health department, the city of Pasco, Greater Columbia, Columbia Safety, Department of Health and University Medicine are partners in this effort.
I was actually going to ask you that question because I had this similar conversation with the same guys about a week ago, and it was about, can you guys do all of it? And I was like, no, I can't imagine trying to do all of it. With all the crazy stuff everybody's got going on right now. But breaking it up into bits and pieces and working with partners makes a lot of sense. And so if we were all asked to, kind of focus on the marketing aspect, get the word out, and drive this point home.
Yes,
that makes a lot more sense.
Yeah.
Okay, I like that.
And I wanted to add to. Go ahead.
Well, I was just going to say we've been participating in this Monday morning call that includes all these partners, not including DOH and University of Washington. But again, there are so many moving pieces to this, Brian. Getting this to happen, the employment, the training, the tents. Tents have to meet certain requirements as far as 55-mile-an-hour wind and flammability, and there is a lot of work to this. And now they're asking us to also think about working to possibly expand this into Yakima. Yep. So we might have a presence there as well, which is exciting.
Well, it makes sense because that's where everybody else is having a hard time being able to participate or bring that piece to the table.
Lauren, right. Sorry.
Lauren.
Oh, that's okay. I was just going to add that I think I failed to mention that our marketing efforts will be in Spanish and English to reach both demographics in the Benton Franklin area. And we're planning on advertising on television, radio, and digital ads. I'm not sure if I mentioned that. Sorry.
Okay. Well, it looks good. I think there's obviously more to come there. I think that limiting it to marketing and letting it kind of grow from there makes some sense. So that's a good, I'm looking forward to seeing what comes next.
Brian, I wanted to address Les's question, and Les, this is a really important question about mobile sites, is that I think Columbia Safety is really interested in doing some mobile testing. And so that is one of the questions that we're going to ask of the employers is, would mobile testing make more sense for your employees? And based on that, we can even envision or think about partnerships with WSU Tri-Cities, who's also trying to get a mobile van for primary care. So it has the potential to really grow and expand in terms of a program that could take vaccinations out to employee work sites. So we're really excited about working with these partners.
Okay, very good. All right, you guys, we are at the end of our agenda and we're at the end of our time. How that worked out, I'm not sure, but I'm glad because I have another one at 3:30. So Is there anything else that we need to address immediately? Okay. Thank you all, and I think it's time to adjourn. Have a good rest of your month, week, and stay safe.
Great. Thanks, everybody.
Thank you.
Good work, everyone. See you later.
Bye, guys.
Thank you.